Good morning, everyone. Today, our group Transformer Wakanda will present about different type of mood disorder definition, cause, symptom, and management. So let's start with the introduction. In this part, I will introduce about normal feeling and feeling caused by the depression. So what's the difference between them? Normal feeling is the human emotion, and it usually happen when we face with the event in the daily life. For example, when you go far away from home, you will feel sadness, and when you face with something you like, you will feel happy. In contrast, the feeling caused by the depression is the one type of mental illness. It can change our perception, emotion, and thinking, and usually this mental illness is lasts very long, usually more than 2 weeks, and it disturbs our activity in normal life, and it may be affected by the alcoholism or drug. Okay, so let's start with the definition of mood disorder. So what is mood disorder? It's the one type of mental illness that can change the human emotion. So though emotion is usually is distort and disturbing the human ability, and it's very hard to function in daily life. So the mood disorder can be divided into two parts: is depressive disorder and bipolar disorder, which will be explained later. And the symptom of mood disorder can be from very low is depressed and up to very high manic.
There are three main causes of mood disorder. The first one is the genetic factors. The foundations of mood disorder are believed to be largely genetic, which is the strongest and most consistent risk factors for this disease. So, when attempting to uncovering mood disorder, it is vital to understand the family's mental health history to know whether an individual may be predisposed to the disorder. If anyone in the family tree has experienced mood swings, particularly in the closest genetic relatives, a person could certainly to be predisposed to mood disorder. Because it appears mood disorder can run in families, there appears to be at least some kind of genetic factors at play. About half the people with mood disorder have a family member with a mood disorder, such as depression. If one parent has mood disorder, there is a 10 to 15% greater chance of their child developing this condition. The risk in a child jumps to a 30 to 40% chance if both parents have mood disorder. Research conducted on identical twins shows that if one twin is diagnosed with mood disorder, it ups the risk between 40 and 70% for the other twin to also be diagnosed.
In this slide, I'm going to talk about how does the environmental factor will affect the mood disorder. Do you know a life event may trigger an episode in a person with a genetic disposition for bipolar disorder? Here I will discuss more about the factor that will trigger the mood disorder. Highly stress condition. Do you know people who experience traumatic events are at higher risk for developing bipolar disorder? Childhood factors such as sexual or physical abuse, death of a parent, or other traumatic events can increase the risk of bipolar disorder. Substance abuse. People who abuse drugs or alcohol are at risk for developing this disorder. Substance use doesn't cause the disorder, but it can cause the mood episode worse and start the disorder onset. For your information, gender also affects the mood disorder. Bipolar disorder affects men and women equally, but women are 3 times more likely to experience rapid cycling of mood episodes. Last but not least, physical, sexual, and emotional abuse. The victim of the abusive violence, such as physical, emotional, or sexual abuse, tend to have higher risk to experience mood disorder.
The third cause of mood disorder is biological abnormalities. For neurochemistry parts, The brain uses a number of chemicals as messengers to communicate with other parts of the brain and nervous system. These chemical messengers are known as neurotransmitters. There are many different kinds of neurotransmitter chemicals in the brain. The neurotransmitters that are implicated in bipolar illness include dopamine, norepinephrine, serotonin, etc. It is known that these chemicals are in some way unbalanced in the bipolar brain compared to normal brain. For example, the episodes of mania may occur when levels of noradrenaline are too high, and episodes of depression may be the result of noradrenaline levels becoming too low. For the endocrinology parts, the endocrine system uses hormones as chemical messengers. These hormones circulate from one organ to another through the bloodstreams. The endocrine and nervous system are linked by the hypothalamus that control many different body functions, including the regulation of blood pressure, hunger, immune response, body temperature, etc. For example, the reproductive hormones are known to affect mood most prominently in women. The source of this effect is thought to be the ovaries, which secrete estrogen and testosterone.
Actually, there are two types of symptoms of mood disorder, which is emotional and physical. For the emotional symptom of depression include thought and attempt at suicide, loss of interest in activities that were pleasurable in the past, unusing anxiety, sadness, or feeling of emptiness, feeling of worthlessness, and the last one is feeling of hopelessness. For the emotional symptom of mania include prolonged period of elation, restlessness, irritability, feeling of grandiosity, and the last one is impulsive. Since bipolar disorder is a combination of depression and mania, therefore bipolar disorder includes all of the emotional symptoms of depression and mania. There are two types of state in bipolar disorder, which is manic state and depressive state. For the different type of state will have different type of emotional symptom. For the manic phase include euphoria, agitation, feeling of invincibility, and the last one is ongoing happiness despite circumstances. For the bipolar disorder associated with depressive state, the emotional symptom is feeling of emptiness, worry, disinterest, irritability, and the last one is sorrow. Now I would like to share with you the physical symptom of mood disorder. Physical symptoms of depression include decreased energy or fatigue, headache, body ache, pain, cramp, or digestive problem. The third one is difficulty remembering detail, making decision, or concentrating. And the next one is loss of appetite or overeating. And the last one is excessive sleeping or insomnia. For the physical symptom of mania include racing thought and jumping from one idea to the next, pressure of rapid speech, increased goal-directed activities, being easily distracted, insomnia, and the last one is hypersexuality. Physical symptoms of bipolar usually relate to behavior. Since bipolar disorder have many types of state, therefore what physical symptom they will have will depend on which type of state the patient have. For the manic phase of bipolar disorder include distraction, inability to concentrate, rapid speech, and the last one is restlessness. For the depressive phase of bipolar disorder include fatigue, difficulty with concentration and memory, a change in sleep or eating habit, and the last one is talking about suicide. So basically, these are the emotional and physical symptoms of depressive, mania, and bipolar disorder.
Management of mood disorder. How to deal with depression. Firstly, there are a lot of ways to deal with depression, and one of it is by staying active. When you are depressed, you may not enjoy doing something that you once loved. However, you may also assume that you won't enjoy doing other activities, but when you do it, you actually enjoy it more than expected. This is because if you don't try activities, you reduce the number of things that may help you to cope with depression. And to increase the number of activities you enjoy, you can list down the activities you used to enjoy, plan one of these activities for each day, expand the time for activities that you enjoy. After that, think about what you like about the activity and share your experience with others. Depression can also affect your sleeping patterns. Hence, it is essential to restore a regular sleep pattern to make a full recovery. You can recover your sleeping patterns by try to go to sleep and wake up at the same time every day. Avoid caffeine and try not to drink more than 2 cups of caffeine-type drinks each day. Avoid using alcohol to help you sleep. And lastly, allow yourself to wind down before going to bed. If you are working or studying, stop at least 30 minutes before bedtime and do something relaxing. Next, people with depression often have negative thinking and are always worrying. This disrupts your ability to focus, and getting better makes you more vulnerable to unhealthy emotions. Some of the tips are: write down what you are worried about. Try not to focus on the things you cannot change. Write down your problems and brainstorm solutions. Jot down the pros and cons with each opinion and choose the one which seems the best. And also avoid making major decisions about your life at this time. You can also get help from professionals. When things started to go bad, do not hesitate to ask for help. With the help of professionals such as treatment and medication, they can bring you back to the right track. How to manage bipolar disorder? One of the ways is to control stress. As stress is a major bipolar trigger, do what you can to simplify your life and relieve stress in your work and personal life. Also, keep a regular schedule. Stick to a routine to help control mood swings, as bipolar people don't do well with lots of changes. You can also practice healthy sleeping habits, as sleep deprived can trigger mania in some bipolar people. Relax before bed by listening to soothing music, reading, or taking a warm bath. Furthermore, regular exercise can also help improve mood. Start slowly by taking a walk, gradually work up and exercising on most days of the week. And most importantly, you should avoid caffeine, alcohol, and drugs. Caffeine is a stimulant which can keep you up at night. Lastly, write it down. Keep a journal that makes note of big events, stresses, how much sleep you are getting, and what you are eating and drinking. Over time, you may see patterns emerging. How to deal with mania? The first and most important thing to do if you think you have a manic episode is to reach out to your healthcare team. This includes a psychiatrist, counselor, social worker, or other mental health professionals. If you are worried that you are close to the onset of manic episode, contact your mental health provider as soon as possible to discuss your symptoms. Also, avoid triggers that worsen your mania. Alcohol, illegal drugs, and mood-altering prescription drugs can all contribute to a manic episode and affect your ability to recover. Avoid these substances can help you maintain your emotional balance. Besides that, maintain a regular eating and sleeping schedule. When you are living with bipolar disorder, having structure in your daily life is vital. This includes following a healthy diet and avoiding caffeine and sugary foods that could affect your mood. Last but not least is to watch your finances. Going on spending sprees can be one of the major symptoms of mania. You can cope with this by limiting how easily you can access your finances. For example, keep enough cash to maintain your everyday lifestyle around your home, but do not have extra cash readily available. You also may want to keep credit cards and other spending methods in places where they are more difficult to use. Some people find it useful to give their credit cards to a trusted friend or family member.
In conclusion, mood disorders are actually treatable. The majority of people with mood disorders are able to find treatments with medical professionals. There are a variety of causes for mood disorders such as poor nutrition, drug or alcohol abuse, stressful life events, or even genetic factor. If you are constantly having mood imbalance, you should try seeking a treatment with a medical professional such as psychiatrist or psychotherapy to have a talk therapy before it becomes severe. Because these type of mood disorders not only become ongoing but eventually will be start affecting yourself and people surrounding you. Millions of people have experience mood disorders and are successfully treated, helping them live a better quality of life. I think that's it from us. Thank you for your attention.